Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press conference. Going forward, Tina Thibault and I will be sharing the role of moderator. Before we begin, I'd like to introduce our Premier, Steve McNeil, as well as the Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy, and welcome. Dr. Strang now will bring us an update on the cases that came in over tonight and the overall view of COVID-19 on Nova Scotia.
Thank you, Premier. Good afternoon, everybody. Today, we're announcing 20 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 193. As with previous cases, most have connections to travel or a known case. In fact, 91% of our cases do. But we do have one confirmed case of community transmission. 9% of our cases we're still investigating, and we don't have a firm conclusion. But we are seeing more and more cases that it's likely it's community transmission, and that's likely to be confirmed in the days ahead. That is not a surprise. This is exactly how COVID-19 plays out. We get it from travel. It starts to get into communities. This is the time when all our public health measures need to really clamp down to minimize the spread within Nova Scotia communities. 9 individuals are currently in hospital, and I'm pleased to report now today that 16 individuals have now recovered, and they can consider to be resolved. We've had now 7,446 Nova Scotians who have been tested but have had a negative result, which is really encouraging. We are testing lots of people, and only a small proportion are testing positive. That is really due credit again to my colleagues at the laboratory. Yesterday they did around 800 tests, and as I said, they have worked very hard to increase their capacity. They're prepared to move to a 24/7 operation if necessary to make sure we have maximum capacity in a laboratory to do as much testing as possible. I just want to let people know that we had, they may hear about a potential COVID-19 exposure notification in the media. Northern Zone Public Health is asking anyone who attended a gathering at the Eagles Funeral Home in Westville and or the Alma Fire Hall on Sunday, March the 15th, to be aware of a potential exposure to COVID-19. There was an individual who attended that event that was not symptomatic but subsequently became ill and tested positive. We now start contact tracing of people for the 48 hours before they became symptomatic, and this individual was at this event in that 48-hour period before coming ill. We are now past the 14 days from that event, so anybody who would have become ill from that exposure would have already been sick. So we're asking people who were at either of those events, if they have developed symptoms of fever or cough, to then call 811 and make arrangements for testing. As we talked about yesterday, we are working on an online map that shows a breakdown of cases by health zone. That information will be going live today. If you look at that, it shows that we have 118 of our cases in Central Zone, which makes sense. That's where the largest proportion of our population is. 32 cases in Western Zone, 22 in Northern Zone, which is Truro all the way over to New Glasgow, then up to Amherst. And then east of that is called Eastern Zone, includes Cape Breton, and there are 21 cases in that area. It's really important that people understand that we now have cases across the province, as I've said previously. I don't want people to focus on whether this community or that community has cases. We have to understand that there is potential in every community in the province, and we need all Nova Scotians, no matter where they live, to be taking the necessary protective steps, practicing good hygiene, staying home as much as possible, social distancing if you're out, and getting together only if necessary in groups of 5 or less. Those are critically important, as I said, in this next couple of weeks, that we really have the opportunity, as we start to see some indications of community spread. Now is the time where we can minimize that spread and really protect our healthcare system, protect each other, and put us in a position to be able to lift some of these restrictive measures as quickly as possible. You'll also see on the map that we've broken it down by gender. So 51 of the cases are male and 49% female. 70% of the cases are in the age ranges between 20 and 64. There's more information on that map. Encourage you to go to that, and we'll make that web link available, and it'll be updated every day as we get new cases. I get lots and lots of questions coming to me, and in the last few days I've had a number of questions around banks, so I just want to touch bases on that for a couple of minutes. Banking is an essential service. We have made sure that they're kept open, allowing Nova Scotians to do necessary banking, but also the banks respecting the rules around social distancing and maximum numbers of people together. I would really encourage anybody who can to do online or telephone banking. There are some Nova Scotians who don't have that option, and so we need to have banks for them. But anybody who can do it virtually, please use that. A couple of the complaints that have come to me are people at ATMs, and people are crowding into the vestibule of an ATM. Let's use some common sense. If you're at an ATM, that's okay. Wash your hands just before you use the ATM, and then wash them again afterwards. Respect social distancing and respect the rules on 5 or less people. If somebody is there using the ATM, stay outside until they're done. If you're with other people waiting outside, keep the 6 feet social distance, and keep an order that people can get in to use the ATM. But let's use some common sense. The question has come up yesterday around the masks, and there's been a lot of discussion in the media around that. I gave an answer to that yesterday, saying the evidence is evolving, and I was informed this morning that the Public Health Agency of Canada is actively doing a comprehensive review of the literature around the question around should the general public, is it helpful or perhaps put them at more risk by just, if they're asymptomatic, still wearing a mask. So we're looking for that review of evidence, and as always in public health, as evidence evolves, we'll adapt our response as necessary.
Thank you, Dr. Strang. Our small businesses and the self-employed have always been the backbone of our economy. But now with COVID-19 being here, layoffs and closures have slowed the pace of our economy. People are scared, and we want to try to reduce some of that fear. Today we are announcing a $20 million worker emergency bridge fund to help the self-employed and those laid off workers who do not qualify for employment insurance. We will provide a one-time $1,000 payment to bridge the gap between the layoffs and closures and the federal government's Canada Emergency Response benefit. The goal is to get the money into the hands of the impact workers as quickly as possible. We also recognize that so many of our small businesses have either been forced to shut down or substantially curtail operations due to public health orders. We know they need help now. That's why we're also announcing a $20 million fund called the Small Business Impact Grant. Eligible small businesses will receive a grant of 15% of their gross revenues, either from April 2019 or February 2020, up to a maximum of $5,000. This flexibility, one-time, upfront grant can be used for any purpose. If you are a small business that just opened in the midst of COVID-19, you can still apply, and we will work with you. We don't want to leave anyone behind. Today's announcement totals $20 million, which will come out of a $50 million fund that will be administered by Dalhousie University. The goal is to begin processing applications early next week to get the cash out the door as quickly as possible. Information on where and how to apply will be made available at novascotia.ca/coronavirus. This is another phase of our economic support plan. The remainder of the money in this fund will be used as per priorities identified in the agreement with Dalhousie. And if it is determined more money is required to cope with COVID-19, government will make decisions at a later date to add to this fund. We'll be happy to answer any questions you may have.
Just a reminder that each reporter will receive one question and one follow-up. We'll open the phone lines to CBC's John LaRoche. Sean, you have a question?
I do. Premier, I'm a little confused at your announcement just now. So it's $20 million from a $15 million pot. Can you kind of tease that out a little bit, because I'm confused?
Made two announcements. There's a $20 million workers emergency bridge fund that will be available for small business owners and those who are not eligible for employment insurance. That'll be a one-time payment of $1,000. And there's another $20 million that will be made available for small businesses. It's a small business impact grant. So that is $40 million in those two programs of the $50 million that we have established with Dalhousie, and the remainder of that money will be used to support other initiatives as we go forward.
Jean, do you have a follow-up?
I do. Look, one of the segments of our population that is incredibly vulnerable at the best of times, let alone in the middle of a pandemic, are those who are either underhoused or homeless. We've spoken to advocates and medical experts who are really concerned that the current measures in place to safeguard these people, in particular pop-up shelters, are insufficient and may in fact be a breeding ground for COVID-19. What further measures are in the works in this province, and when exactly will those be implemented?
There's been work going on with the national government as we speak to deal with the issue of self-distancing in these shelters. We know this is a vulnerable population. There will be an announcement made out in the coming days.
Next, we will go to CTV's Natasha Pace.
Hello. My first question would be for the Premier. We are hearing at the Nova Scotia border between New Brunswick and Nova Scotia, there are some people who are crossing into the province, apparently from other cities like Vancouver, Montreal, and Toronto. Wondering, I guess, first of all, if you've heard of this and whether or not having a large influx of people coming into the province would put a strain on the existing healthcare system?
Well, we've not heard of a large influx of people coming in from other provinces other than those Nova Scotians who are coming home. But everyone who crosses that border is identified and told they need to self-isolate for 14 days here in our province, go directly home, have some of your support team, someone else provide you, pick up groceries, go to the drugstore, whatever you require to help there. But we have not seen a large influx of people coming from other Canadian provinces other than our own sons and daughters and families that are returning home to self-isolate here.
Natasha, do you have a follow-up?
I do. For Dr. Strang, now that we are seeing more evidence of community transmission, are you looking at whether or not there should be more widespread testing across Nova Scotia?
So absolutely we are, and that's one of the reasons we've worked very closely with our lab to enhance that capacity. So as I've said in the last few days, we have removed the travel restrictions. So anybody who calls into 811 and is directed to go to an assessment center will be tested regardless of their travel. We have, for over a week now, we've been testing any close contacts of cases that we identify through public health follow-up. We have testing them right away, regardless of their travel. We are also working now, NSHA, working with workers for with NSHA, IWK, in the continuing care sector, as well as EHS. Any healthcare workers who develop fever or cough, phone into that occupational health line. They are then assessed and then sent in to testing as appropriate, and we're not testing them we're not testing them based on travel. So in a number of ways, we've already started looking, and as we're getting those results and doing the analysis to say what is this telling us about potential for community spread. The good news is that even though we've quadrupled or more our testing capacity, while we have seen some increase in positives, the vast majority of our tests still remain negative, even as we're testing more and more people from the community. And we have other things that we're working on. We're very close. There's some operational details and protocols that need to be put put in place so we don't overwhelm our labs, but we are also looking at some mobile capacities that we can start to deploy. As I said a couple of days ago, we have a mobile unit with EHS that was used to support Magnolia long-term care facility in Enfield that we brought testing to that facility. And we'll continue to look at this and where we need to go with our testing, what is the focus of our testing as we start to look at a community spread in Nova Scotia. We always have to be cognizant of we need to do that in lockstep with our lab, so we don't want to overwhelm our lab, but we have to support our lab who have been very creative and innovative to greatly advance our testing capacity.
Next, we'll go to Global's Jesse Thomas.
Thank you. My first question, it could be for the Premier, Dr. Strang, but it's relating to some long-term or some home care workers. The Nova Scotia Government and General Employees Union have said that 5 home care workers have had to self-isolate because they were in a home of a client who had a family member that tested positive for COVID. I know Janet Hazelton has asked for measures like allowing these healthcare workers to make a decision on when to don a mask, like the N95 themselves. But on top of that, what are the implications of having 5 healthcare workers isolating in the healthcare system at this time? They're giving criticism that there wasn't a great contingency plan in place for these workers.
So I'll take that question. I mean, we have a robust guidance document for both for long-term care facilities and for home care organizations that infection control experts here in the province have provided significant input into, as well as my public health colleagues. That is in place to ensure healthcare workers in those sectors are taking appropriate steps. We're aware of the position of the unions on masks, and we're in the process of having a conversation with our infection control experts to make some assessment of of the validity of what the unions are requesting.
Jesse, go ahead with your follow-up if you have one.
I guess the follow-up would be just around, to the initial question, Dr. Strang, having a loss of 5 healthcare workers at this point through a close contact. Implications like that, what does that do for the healthcare system? We're seeing some of these cases even in more long-term care homes as well. What's it like for, I guess, what kind of pressures is that putting on the system?
So absolutely, both in the acute care system and as well as our continuing care system, we have to recognize that there is the possibility of people being exposed but that's what the healthcare system is for, is to assess and treat people with a range of diseases, including COVID-19. They do have appropriate steps with infection control measures and personal protective equipment to keep them as safe as possible. But it is a reality. Healthcare workers will get exposed. It certainly is creating some pressures certainly in the Magnolia facility. But what I have seen in what I'll call normal times, we tend to act more as a disparate system that doesn't really coordinate necessarily so well together. What I saw in the last few days, the system coming together to wrap its arms around Magnolia and have resources brought to bear from a number of different sectors to ensure that residents in that facility got appropriate care was outstanding, actually. And so we recognize that there are challenges there, but we're working effectively across our healthcare system in a very coordinated manner. Everybody's rowing in the same direction to do what we can to ensure, whether it's in home care, long-term care, or acute care, that people get the necessary care they need and staff are deployed in the right areas.
Next, we'll go to Michael Tutton with the Canadian Press.
Good afternoon, Premier. Will the province provide health care unions with a written agreement that they will give nurses the ability to decide when they need N95 masks, as is now in place in Alberta, Ontario, and British Columbia? And if not, why not?
Well, we're going to continue to work with public health, and I'll have Dr. Strang answer that for you.
So that is the agreement that I just referenced in the previous question that is coming to the department. I've discussed that with the minister. He's aware. We're in the process of working of putting that information in front of our infection control experts and getting their opinion as to the validity of what the healthcare workers or the unions are asking for.
Michael, do you have a follow-up?
Dr. Strang, what is the approximate date, based on the best models you have, when Nova Scotia would have to begin the so-called surge or expansion of its current level of 55 available ICU beds?
So I don't have a date for that. That's an ongoing piece that will continue to be looked at. We provide a daily epidemiologic update to our colleagues in the health across the healthcare system. There is some modeling work that's underway in the department, making some projections, but that's a moving target. And quite frankly, whether we overwhelm our healthcare system or not, which is really what you're talking about, is very much dependent on all the things we do together. This is the message we give every day. The stronger we are working collectively in staying at home, staying apart with each other, washing our hands, all those things that we've talked about every day, those are the tools that we have collectively. If you do those well, that won't put us a position in overwhelming our healthcare system. And so I can't give a date, but the opportunity to minimize that happening is in all of our hands. We know from other jurisdictions that if you do nothing, there's a huge spike in cases and you completely overwhelm your healthcare system. If you robustly apply all the public health measures, you slow down the spread, you minimize that peak. It may spread it out over more time, but you don't overwhelm your healthcare system. So one of the key objectives on everything we're doing is to avoid overwhelming our healthcare system, the question you've asked about. However, there are plans in place based on certain parameters. If we start to meet those parameters around the percentage of occupancy in ICU beds, there are plans in place to bring in some contingency pieces. So the healthcare system is planning for those worst case scenarios, but the absolute hope is that if we all work together, we don't have to implement those worst case scenarios.
Next, we'll go to John McPhee with the Chronicle Herald.
Not the case based on the existing figures and with Dr. Tam's analysis about 3% being critical care, that once you get up to about 1,500 or 2,000 cases in Nova Scotia, and at current rates of almost doubling every 6 or 7 days, you'd probably late April.
Respect your colleagues and let John McPhee with the Chronicle Herald ask his question. John, over to you.
Yeah, this is for the Premier. We know in general that the economic impacts of the pandemic have been severe. Do we have any idea about the specific number of jobs that have been affected here in Nova Scotia?
I don't have that number in front of me. We know that there have been substantial losses, particularly in the service sector. Some parts of our economy are still moving. The manufacturing sector, construction side is still functioning. This is also about the time of the year that you would start seeing major hiring within inside of those sectors because of whether it's the agricultural sector in the planting season or many of our tenders that'll be going out. So most of what we've seen so far has been in the service sector, but I don't have an exact number.
John, do you have a follow-up?
Yeah, this is for Dr. Strang. We've seen a steady rise in case numbers going into the double digits in recent days, but the number of people in hospital has stayed in the single digits. Does this surprise you at this point? Were you expecting to see a more severe side to this pandemic?
No, I think it's what it is an indication of our expansion in our testing. So as we test more people, and aren't testing just based on travel history, we're going to identify people perhaps earlier on in their disease, especially as we're testing contacts of cases. And some of them have been asymptomatic or just very mildly symptomatic, but testing positive. So it's one. If you look at all the literature and the evidence, is one of the things you see when you test early. You pick up people very early on in the disease phase, and while there is no active or definitive treatment on this, you can support people and then give them advice about when they may need to get into hospital as early as possible and get the necessary supports to minimize the chance of having severe progression of the disease.
Next, we'll go to Cassandra Nadeau-Lamarche with Radio Canada.
Yes, so there has been concerns in small communities like Camp about the arrival of out-of-province workers in the fishing industries, which is considered an essential service, so they do not have to have the 14-day isolation period. So what do you have to say to address those concerns, and how do you justify that the self-isolation restrictions don't apply to them?
That was just made known to me today. I've asked our staff to look into the Department of Fisheries and Aquaculture in the province to identify exactly what is happening there. What we have said is in communities across the province where we've had an active fishery, that those fisheries would continue to take place. Some of those are changing now. We're working with our national government. The price is obviously a big factor. Not only it's one thing to secure the catch, it's quite another to be able to sell it. We have many of our pounds are full. So we're trying to identify what is the best thing when it comes to securing our own food supply, but also making sure that the product that is caught is safe and that we can sell it in a market for a fair price. But the issue you raised was brought to my attention and to Dr. Strang's attention today, and we're looking into it.
Cassandra, do you have a follow-up?
Yeah, so other provinces have decided to lower rates short-term for electricity. Are there any talks with Nova Scotia Power to ask them to do the same?
Well, Nova Scotia Power here in different provinces have different rates, so they have peak time, off time, demand, all of those types of things. Here we have three rates. One is the industrial rate, small business rate, and of course the residential rate that all of us receive. Nova Scotia Power has been looking and modeling at ideas of how they can best support Nova Scotia families. That is something they will discuss. As you know, they're a private utility, but they've been very cooperative along with their parent company, Emera, on how we can best address the pressures that Nova Scotia families would be feeling in this period of time.
Next, we'll go to All Nova Scotia's Lindsay Armstrong.
Hi there. For the Premier, can you elaborate on Dalhousie's involvement in the funding you announced? Why are they administering these funds, and what else can they use the $10 million for? I'm also hoping to know what qualifies as a small business for the Small Business Impact Grant.
Well, the Dalhousie has all of the mechanics to be able to move through this with their business school. We'll be using some of their students in finance and other departments as co-op as well. We'll be bringing in some of their sister institution students from around HRM to be able to help us implement this change, using their protocols that they currently have at the institution will allow us to assess the data quickly and then get funding out rapidly. Some of the other funding will be determined as we go through, as we look at what are other initiatives. The rent deferral program is part of this as well. We announced that back a few weeks ago, a week ago, I guess now. And the number that falls under what determines a small business would be is if you were, for this program, is 200 employees or less. I mean, right down to a single proprietor. So it could be a hairdresser who's been working, or it might be a restaurant that has a large number of employees here in the capital region. So we're really trying to address those businesses that were forced to close because of the health order. And it's important to recognize the small business owners across this province, particularly hairdressers, electricians, others, at this point don't qualify for EI. We're hoping that they will, towards the end of April. It'll take much longer for them to get processed. So, and the same for those workers who don't have enough hours. They don't qualify for EI right now. The federal government is committed to working with them by the end of April to have them qualify. So this is a bridge for that group of people to get to unemployment insurance. And the national government has already identified that they are speeding up unemployment insurance for workers and should be ready to go next week. And they've also identified that if your weekly amount would not have qualified you had the hours, but the income didn't qualify for you for $500 a week, they would be bumping you up. So that's why we addressed this subset of our own employees that would not be qualifying right away for the federal program.
Lindsay, do you have a follow-up?
Yes, for Dr. Strang, we're hearing reports from people who aren't able to access essential home care due to staffing constraints. One man who's listed as high priority said in the last 2 weeks there have been several occasions when he's been unable to eat or change his clothes for days at a time, and he's had to go without medication because of canceled visits. Are you aware of this, and is there anything being done to ensure people have access to home care right now?
So I'm not aware personally about that. We do have a group that's bringing together people, colleagues of mine in the Department of Health and Wellness who are responsible for the continuing care sector. They're working with colleagues in the Health Authority as well as all the home care agencies, the Health Association of Nova Scotia, and our continuing care partners as well. So there is a table that is looking at all those kind of issues. I would suggest that if an individual has a concern, they should make that known to the home care agency that has been providing them in support, and that can be brought forward that way, and solutions can be found.
Next, we'll go to the Globe and Mail, Marika Walsh. Marika, do you have a question?
Yeah, hi, Premier. I'm wondering if you can explain why Nova Scotia hasn't released its own modeling about sort of how good or how bad the pandemic can get in the province, and if it will be released in the future.
I'll ask Dr. Strang to respond to that.
So we're in the process of doing that modeling. I mean, that is fairly sophisticated work. Larger provinces have more capacity with the technical expertise. Ontario has Public Health Ontario. British Columbia has BC Centre for Disease Control. Quebec has INSPQ. Smaller provinces simply don't have the type of resources that we can readily turn this around. So we are working at that. And there is a national group that Nova Scotia contributes to. Some of my colleagues in the department their focus is on modeling. But I was briefed on it yesterday, so we are working on some of this modeling. But it is a highly technical piece that like I said, smaller provinces struggle to get to that very specialized skill set.
Marika, do you have a follow-up?
Yeah, I do. Dr. Strang, could you clarify then if you plan to release it later down the road, or if you think that it's just best because of the technical expertise required to leave this part to the federal government?
So we're certainly working on a Nova Scotia model and being supported by the federal government. But each province, this disease and the epidemic, it plays out on a different time frame, and depending on the different measures that provinces put in place. So we each need our own model. As I said, we're working on that. No decisions being made about releasing all that publicly. We'll get to that as we get more concrete with exactly what our model is and what it shows.
Next, we'll go to Nancy King with the Cape Breton Post.
I also intended to. The concerns have been raised by some business operators in Shetty Camp about the number of out-of-province fishermen who are arriving in anticipation of the fishing season. Just wondering if there are any specific, given the close quarters that fishermen work in on boats, are there specific measures that can be taken to ensure that they're able to work as safely as possible, given the physical rigors of the job?
Let me speak to that. Sure. So, I mean, we've allowed the fishing boats as an exemption under the Health Protection Act order, simply because we need to protect our food sources, and as much as possible, as you heard the Premier say, we need to do as much as we can while protecting public health and safety, keep our economy going as best we can. Certainly, advice has been given to both the fishing industry and the processing distancing plans, about adhering to as best they can to social distancing. I think for fishing boats, making sure that people don't go on the boat, go onto the boat to leave the shore if they're feeling unwell. People on self-isolation for travel or whatever absolutely cannot go on those boats. And we recognize there is some increased risk on those boats by taking some precautions about who goes on the boat in the first place, and having paying close attention around hand washing, keeping apart as much as possible as they can within a confined environment will help.
Nancy, do you have a follow-up?
No, that's fine. Thank you.
Next, we will go to Jennifer Henderson with the Halifax Examiner. Jennifer?
Thank you. This question's for Dr. Strang, and it's a follow-up with respect to Magnolia Manor. Dr. Strang, you mentioned, I'd like to know essentially, what does public health know today about how the virus may have been transmitted to staff and residents at Magnolia Manor? You mentioned that yesterday that there was an educational session that may have been part of the transmission. So can you tell us what you know at this point?
So I don't know any more detail. I mean, as a local public health and the regional medical officers of health are intimately involved in that. I hope you can appreciate I don't have the capacity to be involved in every specific case. My job is to look at things from a provincial perspective. I am aware certainly that it's a complex piece where, as I said, there was an educational event that brought staff together. Those people also work out in communities. We've tested. What I do know is that all the residents have been tested. There are no more have tested positive than the original two, and the condition of those original two hasn't changed. There have been some challenges around testing, but we're getting the final piece of staff are being tested, and we're getting all those results are coming in. I haven't had a chance today, frankly, with everything else going on today, to reach out to that regional MOH and get an update on that facility.
Jennifer, do you have a follow-up?
I'd just like a commitment that we could get a follow-up on that situation tomorrow or as soon as possible.
I will make that known and bring back whatever information I can get.
Next, we'll go to News 95.7, Mark Hodgkins.
Hi, my question is for Dr. Strang. Over the last couple of days, we've heard from multiple doctors working in hospitals that say they're concerned about PPE limitations. The NFHA is telling healthcare workers that they're only to wear PPE when dealing with patients who either have COVID-19 or another respiratory issue or were hospitalized while in self-isolation. I do understand people are being screened for symptoms at hospitals, but given what we've been told about asymptomatic spread and that is a risk, is limiting PPE for frontline healthcare workers an acceptable risk?
So I think we need to understand in more detail. We have what do we need to protect healthcare workers, and how do we protect them in the right circumstances? Also knowing that there are levels of risk, and we have to then match up what our PPE supplies are, so people get the necessary PPE that they're looking for. That's one of our challenges with our unions about what's the real necessary PPE for certain types of procedures. I have flagged for a discussion, and I have a meeting with some colleagues tomorrow, that as we start to see indicators of community spread, how do we have to adjust the approach to providing frontline care, and including that is what is the necessary PPE that individuals need to use. That's not just within hospitals. We also have to talk about our EHS crews, frontline pharmacists. So I've asked in that discussion as an urgent discussion starting tomorrow with across the health system about how do we adjust our response around protecting healthcare workers now that we're taking the focus solely off travel and trying to accommodating for community spread as well.
Mark, do you have a follow-up?
I do, yeah. Again, for Dr. Strang, I guess as the province keeps ramping up testing, and you've talked a bit about that, is there any consideration to perhaps regular testing for frontline healthcare workers? Would that be effective? Is that something being discussed?
So that no province that I'm aware of has done that, just routine testing of healthcare workers. Testing would always have to be based on people developing symptoms. We know that there is the possibility of asymptomatic spread or people becoming somewhat infectious before they become symptomatic, but that all the evidence is that that is moderately or mildly symptomatic. We have to have a rational approach to this. There's no way that we could continue to test every healthcare worker because to be reassured, you'd have to test them on a daily basis almost, and we completely overwhelm our labs. So we have to have a rational approach that is based on evidence that balances out what's the appropriate level of intervention and to minimize risk, and balancing that out with the resource capacity that we have, knowing we have to have testing capacity for Nova Scotians as appropriate.
That's all the time we have allotted for questions today. Premier, go ahead.
Thank you, Chrissy. I want you to take a look at what's going on in the photos behind me. The common denominator are kids. I've been worried a lot about our children. These are confusing times, and I want to speak to them directly. It's okay to be scared. It's okay to miss your friends, and it's okay to ask lots of questions. We may not have the answers, but we want you to ask the questions. We know that we have to follow the rules. Stay at home, wash our hands. Many of you, with the help of your parents, are finding ways to have some fun, and that's what I see when I look at these pictures. I want to thank Heather Thompson from the Glasgow area for creating the ultimate online Nova Scotia kitchen party. More than 200,000 members, people performing daily. Like the Kelly family in Glace Bay, rocking it with their basement tunes. The mother and daughter duo, Catherine and Barbara Gillis from Yarmouth, who created a tripod using household items, including clothespins. And what about Chantel McGraw-Pitt's 14-year-old son who sang John Legend's song? He was so nervous he wouldn't look into the camera. But I want to tell you how proud I was as I watched your great strength and courage to perform the way you did. I loved it. I even saw my neighbors, Brady and his mom Michelle, performing together while also asking Nova Scotians to stay at home. And then there's the Sydney Ritter brothers, Liam and Lucas, who launched their own weekly broadcast called East Coast Kids News. Thank you for representing Dr. Strang's protocols every week. You're doing an outstanding job of inspiring all of us. And for telling your audience what it is about all the cool new apps that are out there. But not everyone has technology or the supports at home with their daily existence, and their daily existence can be pretty lonely. I see neighbors who have made coloring books and crayons, board games and puzzles available, anyone on the block or in that street. And I know this is hard. I know if you are feeling isolated or scared, reach out and talk to someone. You are not alone. We want you to understand you are not alone. And if you are scared, it's a normal feeling. And if you're feeling alone, reach out and ask a friend. I am so proud of the people of this province are coming together to support one another. Visitors have always talked about our East Coast hospitality and our kindness. Now we are putting all of that into practice with each other. Stay safe, stay strong, stay together. We've got this.